Hi, this is Dr. Jaime Daniel, and welcome to my podcast. Today, I want to share with you about angioedema. Sometimes we hear about this thing and have no idea, but today you will learn a bit of things that will help you to recognize it and how to manage and what to do, what to expect, and well, enlighten you in this pathology. An angioedema is self-limited, localized subcutaneous or submucosal swelling, which results from extravasation of fluid into interstitial tissues. Angioedema may occur in isolation, accompanied by urticaria, or as a component of anaphylaxis. Typically affects areas with loose connective tissue, such as face, lips, mouth, and throat, larynx, uvula, extremities, for example, knees, and genitalia. Bowel wall angioedema presents as a colic abdominal pain. Angioedema can be distinguished clinically from other forms of edema by some of the following things: onset in minutes to hours and spontaneous resolution in hours to a few days. Asymmetric distribution, tendency not to involve gravitationally dependent areas, involvement of face, lips, larynx, and bowels, association of some forms of angioedema with other signs and symptoms of allergic reactions or anaphylaxis. There are two types of angioedema that can be distinguished: mast cell-mediated, also called histaminergic angioedema, and bradykinin-mediated angioedema. However, for many of the known triggers of angioedema, the mechanism is still unclear. When angioedema affects sites, we can say, for example, larynx. Laryngeal edema can develop rapidly over minutes or slowly over several hours. Early symptoms include hoarse voice, throat tightness, and difficulty swallowing. Assessment and treatment are things that you should discuss with your healthcare provider. And when it affects the lips, tongue, and uvula, and other structures that can be also affected, angioedema, they results in airway compromise. There is some certain medication that can induce this uh, presentation. If you suffer for high pressure, maybe some of your medication can produce this in your body, like swelling of the lips, tongue, face. All the other causes of angioedema affects these structures as well. In contrast, swelling of the floor of the mouth is more likely to be caused by tumors or infections or even lithiasis. When angioedema affects the subcutaneous and submucosal tissues, there is pruritus absent. One will expect to find them, but you will not find them unless angioedema is associated with urticaria lesions, which are intensely pruritic. The skin is either normal in color or mildly erythematous, reddish. Mild pain and warmth may be present, but are much less prominent than the pain and warmth of cellulitis. Some patients describe the discomfort of angioedema as burning in nature. Angioedema resolves without leaving residual marking of the skin unless there has been trauma-induced or rubbing or scratching. When it happens in bowel wall, the angioedema affecting this part present as a abdominal pain, sometimes accompanied by nausea, vomiting, and or diarrhea. Bowel wall edema can often be visualized by abdominal computed tomography or an ultrasound. Bowel wall angioedema is occasionally seen in patients that are using some medications for high blood pressure and frequently in those with hereditary or acquired deficiencies by genetic. Now, there are some cases when angioedema can affect and threaten life. It usually happens and begins in a transient condition. Although it can be life-threatening because when it is a severe angioedema affecting the larynx, the upper airway, or tongue results in airway obstructions. Therefore, there is no way the air to pass to the lungs. This characteristically happens in anaphylaxis and in bradykinin-mediated forms of angioedema. Well, your healthcare provider will do some evaluations and ask you for some questions about your history and do a physical examination. Maybe will request you to do some laboratory tests to get more information and to discuss some other pathologies that might be related to this problem. Also, the diagnosis could be easy, as we said, using a simple ultrasound test or even by just looking at the patient. But it can be confused with contact dermatitis, cellulitis, and erysipelas, facial lymphedema, autoimmune conditions, eyelid edema, parasitic infections, hypothyroidism, superior vena cava syndrome and tumors, cellulitis glaucomatosa, also known as Meescher's cheilitis and Merkerson-Rosenthal syndrome. There is also the idiopathic edema and the factitious angioedema. Some of the disorders can affect the laryngeal and do edema, but well, the treatment first, depending the condition, is to get an open airway. Once you get assured that the flow of air is going through the larynx, everything can be managed with no problem. And it's better for you and for your patient to know it. And there is also angioedema with anaphylaxis. This is due to the consumption of some medicines or maybe some foods, for example, fish intoxication. And there is also the acute allergy angioedema, or maybe less severe than anaphylaxis. Well, as I told you, if you suffer from high blood pressure, maybe some of your medicines eventually will produce you some of these angioedemas or some reactions very similar to them. And you can get some medicines from your healthcare provider to help you with the symptoms and to stabilize this problem. If you want more information about this, well, you should put it down in a paper in order to make it easier for your healthcare provider about your doubts and all you want to know if you have ever suffered from this condition, and he will answer you. Remember, the best thing is always to get a prescription. Avoid self-medication. And this is everything for today. Thank you for your attention.